Good morning, this is Dr. Doreste with the Cranial Release Technique. Sunday morning, the 9th of June, early in the morning, and a lot of us are probably going out today. It's a beautiful day here in New York City. Going to go out, going to do your morning jog or your bicycle ride or go to the gym or whatever it is that you do from an athletic perspective. And I wanted to touch on something because I've been getting a few emails about, we hear about CRT in improving health, we hear about CRT in children, we hear about CRT in the elderly and enhancing function in the nervous system. But what about CRT in sports performance? What about CRT? Can it help my athletic performance? So I just wanted to touch on a few topics and then tie it all into CRT and go and enjoy your Sunday. One of my favorite posters is the CRT Choice poster, and again, we've reviewed this poster in quite a few previous videos. Excuse me. Ideally, we'd all like to be the man in the middle here. And when you're in the middle, what I mean by the man in the middle is that the brain hemispheres, the left and right hemispheres, are balanced from an electrical standpoint. When the brain hemispheres are balanced, the muscles are balanced. When the muscles are balanced, the structure is balanced. And that's the way we're supposed to go through life. Balanced brain, balanced body. Let's make it as simple as that. When that's happening, the autonomic nervous system, or as we've referred in other videos, the automatic nervous system, is doing the healing, the repairing, the regeneration. The body is constantly rebuilding itself. And again, what is going to cause you to be figure number 1 or figure number 3 basically comes down to the brain's inability to handle stress, whether that's physical stress, slips, falls, car accidents, playing sports, not playing sports, poor posture, gravity, all the things we could list in the physical category. Number 2, emotional stress. Problems at home, problems on the job, problems in relationships, problems with finances, the emotional aspects, the push and pull that all of us experience in this thing called life. Number 3, the chemical stresses. What's in the air, what's in the water, what's been injected into you, what's in the cleaning products. We can go on and on and on. There's a lot of alternative green products now available, so it's making things better. Thank God. I'm glad to see that. So that's we had the physical, the emotional, the chemical, and number 4, the new kid on the block, the EMF, the electromagnetic frequency stress. The cell phone towers, the cell phone signals, the Wi-Fi environments. And that goes on and on and on. And it seems that we're more and more in a Wi-Fi environment, unless you're going to get out into the middle of the country somewhere. But then even then, all you have to do is check your cell phone, and if you're getting any bars, well, then your body is receiving a cell phone tower signal. So keep that in mind. There's very few places now where there's no cell phone reception. So those 4 stresses constantly build and constantly tend to destabilize the central nervous system until eventually you shift and you become figure number 1 or you become figure number 3. And it really doesn't matter to me whether you're figure number 1 or figure number 3, because in theory the same thing is happening. One of the hemispheres becomes overactive because of stress. That's going to cause an imbalance in muscular tension throughout the body. Remember, the left brain controls the right body. The right brain controls the left body. So we have muscle tension imbalances, structural imbalances, and now the nervous system shifts to survive, protect, defend. And you're stuck in that sympathetic fight or flight mechanism. And in my opinion, most people going through life that I encounter are stuck in this sympathetic mode. And all you need to do is watch how people drive, watch how people talk with each other, watch how people walk. Just observe behavior. And it's almost like they're on automatic pilot. They're not even aware that they're screaming or they're driving aggressive or they're doing whatever the fight or flight mechanism is really dictating that they follow that behavior pattern. So now this figure number 1 or figure number 3, doesn't matter to me, I'll just pick number 1 for now, goes and plays sports. Whether at a professional level, at a college level, at a high school level, at a grammar school level, at the little pee-wee football or pee-wee baseball or whatever it is that they're playing. And so now because of the brain imbalance, the structural imbalance, the muscular imbalance, now it's time for baseball, basketball, soccer, football, whatever it is that you would like to play. And now because of this brain imbalance, the muscular imbalance, the structural imbalance, now they're much more likely, number 1, to not perform at their peak, and number 2, they're more susceptible to injuries because of the imbalances. And then if you're a practitioner watching this, they're probably coming to you because they told you, well, I injured my ankle playing football, I injured my shoulder playing baseball, whatever it happens to be. And then, as most practitioners will do, you'll go and start to work on the shoulder or on the back or on the hip or on the ankle. And most of us tend to neglect the brain. So the first thing I would do if someone came in, or a CRT practitioner would do when they came in, is, of course, we take the history. Okay, it happened to the shoulder while you were pitching a baseball game. Okay, great. Now first let's balance the brain with CRT. Then when we get you to the middle, now maybe some of you will work on that right shoulder or that left hip or that right ankle or whatever it happens to be, the spine, the neck, the mid-thoracic, the mid-back, the low back. In my experience, after you balance the brain and balance the body, you certainly can go in and then do your secondary work on the extremity or the joint, wherever that happens to be. But there are many of us that basically leave the patient there and let their body heal and repair itself in that balanced state. So something to think about if you're a practitioner. If you're a patient and you're noticing, oh, it's always that left ankle or always that right knee or always that left hip or right shoulder, whatever it happens to be, and you're going to a practitioner and you're getting your injections or you're getting your therapy or whatever it is that you're receiving, you might want to consider CRT to first of all balance the nervous system, balance the muscles, balance the structure, and then see the therapist for the shoulder or the acupuncturist or the orthopedist or the chiropractor for whatever else that needs to be done, or the massage therapist or whatever, the myofascial therapist. We can go on and on and on. So I wanted you to be aware of that. Start thinking brain, start thinking nervous system, start thinking CRT. Again, to me, whether we're talking about sports, whether we're talking about whatever profession you do, if you're an accountant, I'd rather go to an accountant with a balanced brain than an unbalanced brain. I'd rather go to a psychologist with a balanced brain than an unbalanced brain. I'd rather go to a barber with a balanced brain than an unbalanced brain. And we can go on and on and on. I'd rather see moms and dads with balanced brains doing a better, having a better internal balance. I think you'll raise better children. I think you'll be a better father, you'll be a better mother, you'll be a better child. So keep that in mind. The CRT choice. There's another choice out there. It's called the cranial release technique. Please visit the website at cranialrelease.com, and there you can search for a practitioner in your area. You can learn more about the actual training. How do you learn this work? The CRT online training button's right there. You can order a free report. You can hit all the buttons, have some fun. Visit the blog. Again, this is Dr. Doreste with the cranial release technique. If you already have not subscribed to my YouTube channel, you might want to do that as well. You can go to YouTube and type in cranial release technique, and you can visit and subscribe to my channel. My name is Dr. Doreste. This is the cranial release technique. And by the way, just to clear up some other issues, there are no instruments used in CRT. There are no balloons. There's no other apparatus other than the practitioner's hands and the patient's head. There's been some confusion out there in the internet with other cranial-based techniques. So CRT is hands on the head. That's about it. It's very simple, very powerful. Again, start thinking brain. This is Dr. Doreste with the cranial release technique. Thank you so much for watching this short presentation. Enjoy the rest of your Sunday. Adios, my friends. See you soon.